Health Break, brought to you by CHI St. Joseph Health.
The muscles and tissue that support a woman's pelvic organs can weaken over time, resulting in pelvic organ prolapse. Dr. Magdalene Carone says a robotic surgery is a great option to reconstruct these tissues.
The instruments are so gentle and delicate on the tissues. The visualization is amazing because you have basically 3D vision 10 times magnified. It's gentle on the patients, on the tissues, less blood loss, less bruising, less postoperative pain. Even the nurses on the floor can tell that patients that have had that approach get up faster from the bed and complain of less pain and have more mobility. Almost 2,500 cases. All of my patients are outpatients. Even the more difficult cases are what we call 23 observations. So they spend one night, the next day they go home.
For more information, go to chistjosephhealth.org.